As concerns grow about Robert F. Kennedy Jr.'s leadership as Secretary of Health and Human Services, we are learning more about what could be part of a sweeping and already controversial report about autism that Kennedy has promised to release this month. The report he has suggested would identify the cause of autism. The Wall Street Journal reporting Kennedy is planning to announce a link between autism and Tylenol use by pregnant women and suggests folate could prevent autism. This despite zero credible evidence scientifically that either is actually true. Joining us now, Cheryl Gay Stolberg, Washington correspondent for The New York Times, and Dr. Derek Haas, a former regional director at the Department of Health and Human Services. Dr. Haas, a reminder, when I was pregnant, just like so many other women, I was told Tylenol was the safe pain reliever, the one to take. So what does the science say? Is there any evidence that there's a connection to autism?
So Tylenol is still the safest pain reliever and fever reducer for people who are pregnant in the United States. Nothing has changed about the science. What we know is that we've heard rumors of a leaked report coming from HHS. We have not seen the report. We don't actually know what's in it. We've heard that they're going to say that in some patients, maybe the use of Tylenol with certain risk factors might increase the risk of certain diseases, including autism. But nothing has been given to us to evaluate, and nothing has changed about the recommendations for pregnant people.
Women are also told to take folate supplements when you're pregnant. And according to the Wall Street Journal, Kennedy is expected to say a specific form, folinic acid, can decrease symptoms of autism. Can you separate fact from fiction there? And could too much folate also be a danger?
So remember that this is also not new information. It's been shown that in some people who are folate deficient, adding back folate in form can reduce symptoms of autism. And that's well known to doctors who treat patients with autism. It's also been true for years that pregnant people should take folate because folate deficiency can cause all kinds of problems, including a disease called spina bifida. So again, this is not new information. There are no new recommendations for people who are pregnant, and we should listen to our doctors and not to RFK.
So, Cheryl, again, we are expecting this as part of a report on autism that Kennedy has promised to release this month. So he gave himself this deadline. What is the expectation for this report now? And how much of it could actually have a foundation in science and facts?
Well, so the expectation is that he will release this report this month. He has said that he would release a report that identified the cause of autism by September. And I think most credible scientists would say that is not possible. If we could identify the cause of autism, we would have already identified it. There are numerous factors. Many studies have pointed to genetic factors. So having not seen this report, and I should say that we haven't been able to independently confirm exactly what, if anything, he's going to say about Tylenol. I think we're just in a kind of a wait and see game, but I do think it's safe to say that we won't be settling the question of what causes autism as if there could be any single cause.
Right. And I think that's very important to point out, too, that experts, including Dr. Cass, have said that there just is not likely to be a single cause. It's probably a culmination of different factors. Cheryl, after Kennedy faced blistering questions from lawmakers that we all saw here on MSNBC about the safety of vaccines and other health issues, we saw the president break with his HHS chief on this issue, specifically on Friday. Take a listen.
Look, you have vaccines that work. They just pure and simple work. They're not controversial at all. And I think those vaccines should be used. Otherwise, some people are going to catch it and they endanger other people.
So far, President Trump has stood behind Kennedy, but he likes to say he likes things that are, quote, different, or that he likes that about Kennedy specifically. That said, when it comes to public health and safety, Cheryl, could there be a breaking point between these two men?
I think there could be, but I don't think we're there yet, quite frankly. This is the stance that Trump has taken all along, at least since 2015, when he was on the presidential debate stage and raised the concern in his mind that vaccines are linked to autism. But he has never said anything disparaging about other vaccines. He also recognizes the politics here. A Republican pollster put out a memo warning Republicans, this is before Thursday's hearing, that it would be folly, in his words, to mistake skepticism about the COVID-19 vaccine for skepticism on all vaccines, and also noting that swing voters offer sky-high support, their words, sky-high support for vaccines, particularly childhood vaccines. So Trump is kind of hedging his bets here. He's not exactly rejecting what Kennedy says. He's not rebuking him publicly, but he's also not enthusiastically embracing him.
Yeah, 78% of Americans strongly support the use of vaccines in our new NBC poll just over the weekend, including 67% of Republicans. So that is across the board support and approval for vaccines. Cheryl Gay Stolberg, Dr. Derek Kass, got to leave it there for now. Thank you both for joining us.